Good evening, everyone. I'm Dan McKee, Lieutenant Governor, and welcome to our community conversation. We're here every Wednesday evening at 7 o'clock. We started this up during the beginning stages of the COVID-19 virus to kind of make sure that we're connecting our office with people throughout the state of Rhode Island and beyond, talking about those issues that are front and center and impactful issues that we're dealing with every day right now during the pandemic, but also efforts that are going to carry us after the pandemic. So very eventful day today in many ways, right, with the new president, President Biden. I was very happy to be one of the original supporters in the state as an elected official. I felt as though that he was going to be able to unify, and he brought a certain level of integrity and character to that position. And I'm looking forward to having in my new role, which is coming up as governor in the next few days. There'll be just a few weeks to have a great working relationship with the new administration. And of course, historically, right, first woman ever to hold a White House position, whether it was president or vice president. Today, with Vice President Harris, quite an achievement, and certainly we're going to talk about that tonight because we've got many of the strong advocates for the women's issue in Rhode Island now, and we're going to hear from the doctors and others that are on the board to talk about what that meant to them today, and also what's on the horizon in terms of their efforts and their agendas relative to the issues that are really important to their efforts. So I want to just say that as we always have, I'm really interested in this education issue. We need to make sure that we're doing something intentional in the state to compensate for all the lost learning time that the students are boys and girls that are in our schools right now. And it doesn't matter, really, as I've said over and over again, it doesn't matter whether you're high income, low income, moderate income. It doesn't matter if you're minority, non-minority. It doesn't matter if you're a boy or a girl. Going to a public school, a private school, a charter school, a Merrill Academy, and even homeschooled. If you live in Rhode Island right now, we're losing hundreds and hundreds of hours, students, in terms of learning time, to no fault of the school systems. We're dealing with a COVID, and we're dealing with the virus, and we're dealing with a pandemic, extraordinary times. And those extraordinary times are forcing our hand in our schools. So a lot of hybrid models, internet models, virtual models. But we know the data shows that no matter how hard you work, we're losing hundreds of hours of learning time. Every student in the state of Rhode Island is losing learning time. So I'm suggesting that we really take a look at what I did as a mayor and opened up an office for children, youth, and learning, a mayor's education department, 52 weeks out of the year, working on reading and math and science and art and music. And other educational matters that out of that Mayor's Office of Education, and duplicate that around the state of Rhode Island. That's one way that we can catch up on many of the hours that are being lost over the next few years of the students that live in Rhode Island, and also helps us specialize on some of the topics that, quite frankly, the school departments don't have time to put in there in terms of civic engagement, in terms of Black history and minority history, women's issues, all the types of issues, the business issues, talking about an entrepreneurship program in those programs, helping our young entrepreneurs develop their skills. So that's something I really want to have happen. And hopefully, as governor, we'll be able to help introduce the concept and figure out a way to really help those students. Their careers depend on it. Their families' income depend on it. Our communities depend on it, and our state does as well on many levels. So, Ben, please bring on Dr. Hillary Friedman, Dr. Wendy Plant, and also it's Lilia or Lila. I'm sorry.
It's Lilia.
Lilia, I thought it was. Okay, Lilia Hope, yes, who is a board member and co-chair with the RI Now PAC. So. So let's introduce ourselves. Dr. Friedman, introduce yourself first, and then we'll go around to Dr. Plant and then to Lilia. That'd be great.
Hi, I'm Hillary Levy-Friedman. I'm a doctor in the Dr. Joe Biden sense. So I'm a sociologist by training, and I teach in the Department of Education at Brown. I've been president of Rhode Island Now for 3 years up to this point, and it's been exciting and challenging, but we've had lots of really meaningful victories, and that makes it all worth it, both at the State House and at the ballot box. And I think, well, I can say for myself, I've made lots of great friends along the way. So yes, I teach at Brown. I taught for the first time this semester, this afternoon. So I myself did it from right here for over 2 hours doing a seminar. So that's always an interesting experience. Hopefully we will be back in person next week. I had a book come out in August, so that's definitely one of the big things that has happened to me in 2020. That book is called Here She Is, The Complicated Reign of the Beauty Pageant in America. And my first book is called Playing to Win, Raising Children in a Competitive Culture, and that was about competitive youth after-school activities. So I'm the mom of 2 boys who just turned 7 and 9. And they are hopefully going back to school tomorrow, or I should say they are going back to school tomorrow. The school better be open because they're going to be there. So that takes up a lot of time as well. And yeah, just excited to see what 2021 will bring with so many new leadership changes.
Yeah, so thanks for being here, Hillary. And your books, so you're an author as well. In addition to what type of programs or curriculum are you teaching at Brown?
This semester, I'm teaching an undergraduate research methods class about qualitative methods. So like interviewing people and participant observation, and doing lots of virtual observations this year too. And over the summer, because there's a summer term for first years who this is their first semester in college, they didn't come this past fall, I'm doing a seminar called the After School Hours. So the various ways, mainly positive, but also some negative, that kids can engage in the after school hours, because the space between school and home is maybe a bit more blurred these days, but has really been historically important over the 20th century.
Well, thanks for being here. And we, many people are watching this, and it's an opportunity for people to share this out. They can ask questions of you that we can, that Ben will be able to, share with you, and we'll have a good hour session here to talk about the issues that you're really front and center on today. I'm going to go around anyways to ask you your thoughts on our new vice president and what that means to the work that you're involved in. But let's go to Wendy. Dr. Plant, please introduce yourself first, and then we'll kind of get around to an open conversation.
Sure. I'm Wendy Plant, and during the day I'm a pediatric psychologist. I work a lot with children and teens, not just who are experiencing stress and anxiety, but those with medical issues. And I'm also involved in as a faculty member at the medical school. And so I've been involved for a long time in advocating for kids and for Rhode Islanders in general in terms of healthcare and access to mental health. And so I've been doing that kind of as a hobby on the state side and federal with my psychological association. And after the 2016 election, I just really felt like I needed to band together with other people who are interested in advocating for the same things I'm interested in. And I've been involved in a few different coalitions and organizations, but I really got more involved with Rhode Island Now because it was a group of people who are really helping, just people like me who are just raising a family, working in the state, who wanted to get more engaged. Like, how do we get more people elected who are progressive, who are feminist candidates? How do I just, carving out hours in the evening or on the weekend, help to educate myself, but also make some change in the state? So I found that this was a really great group to be able to do that. And I've been involved since, and a lot of my involvement is with the Political Action Committee of Rhode Island Now.
Well, Wendy, thank you for being here. Appreciate that. Lilia, please introduce yourself, and thank you for being here. Appreciate it.
Thanks for having us. I'm Lilia Holt. I'm the co-chair of events for the Rhode Island Now chapter. I'm also on the PAC board as well, so I do both ends of the RI Now spectrum. During the day, I work in the financial services industry, focusing on marketing for fixed income investment products. I also have an MBA from Simmons College, and it's actually that program that really opened the door for me, not just in my career in business and in finance, but also it gave me the opportunity to meet a lot of women that have kind of paved the way in that industry and got me very interested and motivated to pursue that career. So I actually grew up in Providence, Rhode Island. I'm a proud graduate of Classical High School.
Nice.
And so when I moved back to Rhode Island, I was introduced to Hillary because I was really looking for a little bit of balance, a way to participate more in the community and get involved with an organization that promotes women in the day-to-day, but also helps elevate women in the political scene as well.
So as a volunteer, Lilia, that's I think that's one of the really contributions that people who are volunteering into these these efforts. Had you had a kind of a history in your family of volunteering, or was that something that in stepping up like you have in this organization RI Now, or is that something that was maybe in your family or in your parents or your mom, or where does that come from?
It definitely comes from my mother. She was very involved, and my grandmother actually very involved in kind of understanding politics and also the feminist movement, but that along with just kind of community activism. So yeah, it's definitely been passed down through a couple of generations, and my mother still is in Rhode Island, and she's a great person to talk to whenever I have a question or just need someone to lean on.
Well, I have to add, Lilia's grandparents were Holocaust survivors, so she's always been involved in fighting against discrimination and inequality. Yeah,
so our history does drive us to the things that we do during today, and but I think that it's also a great example that that all three of you are setting examples for other young ladies and men and young boys to kind of step up and speak out and to drive agendas that are important to you and create a better community. I really can't let today go by without let's going around the horn here and just get your sense on what happened in Washington today, not what happened in Washington on the 6th of January, but what happened today and what did that mean to you, Hillary, in terms of what you saw in DC today?
Well, I have to say, when I turned on the TV sort of early on when people were just coming into the Capitol, I got really emotional sort of from the pageantry and the ritual and the history. But in particular, when our vice president was sworn in, not just that Vice President Harris was there and breaking so many glass ceilings and becoming the first in so many ways, that she was sworn in by Justice Sotomayor. It just really overwhelmed me. I knew that it would be emotional, but I actually really started sobbing like a lot. And my kids were watching with me and they were like, "What is wrong with you, lady? Like, what is going on? I don't get it." I can try to explain just how historic it is, but it's hard for them to understand because, they can't appreciate the magnitude. And to them, when I say that's the first woman who's ever been vice president, they're like, okay, but like, we'll have a woman president soon. Or when I say that's the first woman of color, like their worlds are so different. They can't understand that that's the first or why someone wouldn't have been in those positions sooner. So it was meaningful. I guess I should be grateful for our virtual school that I was able to watch it with my sons today and explain to them why this was such a big deal. I mean, I definitely teared up a little bit when President Biden was sworn in, especially because seeing yesterday when he spoke about his only regret was that his son wasn't there. That really, really, really got me yesterday as well. So obviously the past 4 years have been difficult in a multitude of ways for the issues I care about, but more significantly just for respect and civility and discourse. And, I look at the former presidents who were there, and I believe that they respect our country and the traditions and the norms and the rituals, and the fact that no longer President Trump didn't even attend sort of sums up all that I think we have had to contend with over the 4 years. So definitely I slept better last night. I'll sleep even better tonight, and just excited to share this moment and take that momentum forward.
Yeah, thanks for sharing that, Hillary. Build on that, Wendy, a little bit in terms of your thinking.
Yeah, well, I will echo part of what Hillary said. I have 2 teenagers, and so I get a lot of eye rolling just normally. But when I cry at these things, I get some extra eye rolling. And I do think it is part of it that, my children are growing up in a time where there's still a lot more work that needs to be done, but a lot of the faces they see are more diverse than when I grew up. So I do try to let them know more about the history and why these things are hitting more emotionally. I was definitely moved by the whole ceremony. And a lot of it was just all of the faces that were on that screen, and the ways in which inclusion will hopefully be more of a mark of who, choosing the best, the brightest, the most competent, and helping people have a voice who didn't have a voice before. And I was very moved by the inaugural poet. I always like a good inaugural poem, but I'm going to watch that one a few more times.
Yeah, I was not able to see all the things today, but I'll catch up after this call. But I was told that was quite a moment that with the poet and the presentation, just the presentation of that young lady. I did see a couple clips on the news tonight. Lily, your thoughts on what you just witnessed today in DC?
Well, I think the past couple of days through the inaugural ceremonies have been exceptionally moving. Starting yesterday with the COVID-19 memorial that kind of brought us all together as a country to grieve when we really haven't had that experience yet. Kind of started off these few days of inflection and reflection for all of us. For me as an individual, but also I know for my family as well. It was very moving. But just with Vice President Harris becoming the first female elected national figure was incredible for me to be able to watch today, to kind of bring it back to my own experience a little bit in my MBA program, seeing women in finance that you can mirror and that have paved the way for you to, you're able to just realize yourself in a world that sometimes you don't even picture yourself in until you see someone else in that role. So I think for a lot of women and girls in this country, just seeing her in this position is momentous. It's a really incredible moment.
Yeah, it's like something that I wouldn't understand as much as you understand, in terms of that experience. So thanks for sharing that. And let's bring it back a little bit into Rhode Island now in terms of, what now RI now is looking to work on. And, we've been fortunate to have Cheyenne in our office that has been just fabulous. And, making, the role of my staff has been to get my feet on the ground and make sure that I'm out and about, whether it's doesn't matter what community, all 39 cities and towns, but also the communities that make up the communities is so important to be out and talking. So we've been fortunate to have a couple of the young ladies that worked with me on my campaign, during the time frame. And so tell us, you see a picture there of Gabby Gifford that I was able to meet, at one of your functions. talk a little. Yeah, let's talk a little bit about your functions that you've been able to have, and the people that you've been able to bring in to the into Rhode Island, and what that has meant to your organization. It certainly has created a great deal of credibility to see somebody like the former congressman here, talking about these things. So, yeah, jump in, Hillary, and then again we'll go to Wendy and Lily, if that'd be great. Oh, there's one of our governors there that now is going to be NG secretary, right? You have some pretty good people there, huh? At your house.
Yeah, so those were two events we had recently. So this event with Governor Granholm, where you were pictured with Governor Raimondo and Secretary of State Gorbea and Treasurer Magaziner, that was one of our Rhode Island Now PAC events. So it was amazing to bring Jennifer Granholm here, a female governor who had been doing amazing things in terms of teaching at Berkeley Law and being a commentator and staying involved in politics. And now, of course, she, once confirmed, will be Secretary of Energy. I have to say, I grew up in Michigan until I was 18, and she was governor of my former state, and now my home state, Governor Raimondo here, and she's going to be in the cabinet. So that was pretty cool for me personally. And fun fact, Jennifer Granholm competed in pageants. So I always find a pageant link, because there's lots of pageants and politics links. But, I think that this is a great example where we're able to inspire people to run for office, provide a way for those who maybe don't want to run themselves, but want to support those who are. That's one of the main things that the PAC does, in addition to endorsing. So that was a big deal. We did also welcome Congresswoman Gabby Giffords, because Rhode Island Now, particularly in the past year, has become much more involved with the gun violence prevention campaign in Rhode Island. So last year, pre-COVID, a new campaign came together to advocate for gun violence prevention, and lots of different organizations working together. I think they'll be on speaking with you next week during the show, or I know they will be. So you'll hear more about that. But we were able to bring in Congresswoman Giffords to support that work and help fundraise, because of course we always need some funds to be able to do the advocacy work in terms of legislation that's so important. So that was also very exciting, because another great female leader. And then in the last few pictures that you showed, we had the then president of the National Organization for Women come in from Washington, D.C. to speak at the Rhode Island State House about the Reproductive Privacy Act and to advocate for that bill to get out of the Senate Judiciary Committee, which just a few days later, it was voted out. And we know that in 2019, that bill was signed by the governor. So that was something that people had been fighting for years. So I think what Lilia was saying too, like when you see people in these positions, when you're able to interact with them, it just gives you the sense that you can be there and you can be involved. And sure, not everybody wants to run for office, but there's a way for you to contribute. And Rhode Island Now is here to help people contribute in whatever way they feel comfortable with, and maybe at times to push the boundaries of what people feel comfortable with, but definitely to engage, because every person's voice matters.
Yeah, and I think that it adds a great deal of credibility to an organization when you have, leaders that are recognizing, and they wouldn't be coming, both the governor and the congressman wouldn't be coming to share, their time with you unless they saw you, the organization as credible and that somebody that was, worth spending time with. So I think it adds a lot of credibility to your work. Wendy, give us a little bit overview of, not only these events, but some of the things that, a Rhode Island centered. I believe that, Rhode Island is, my focus. National issues are great, and I'm really proud of what happened in DC today. And it was a hallelujah moment for me, as I was texting out to my friends, clearly. But tell us a little bit about what you're anticipating, as an agenda in a very interesting time, right? This COVID-19 General Assembly is going to have a tough time functioning during this period of time. I happen to believe that they should be on the vaccination list, because unless they are, you're not going to have another General Assembly. You have an abbreviated General Assembly session again this year. They had a certain amount of infection rate that happened right in yesterday, where they had to shut down the Senate and the House. But so in a difficult time like this, in terms of the the agenda, or the purpose that you're trying to move forward this year? What does it look like? And I will have everybody weigh in on that. I think that'd be good to hear.
Yeah, I mean, when you were talking about these events, I was again thinking about sort of the people who want to be involved and want to be engaged in the issues. And I think for an organization like us, part of it is to figure out how we can pivot and be creative in both being able to talk with our lawmakers about the issues that are important to us, but also as well as how we continue to keep Rhode Islanders engaged and feeling like there's a way that they can be involved when we have to socially distance. Some of the things that we've done is you've shown these speakers and these role models who've been able to come, but also a lot of what we've tried to do is just help our members and help the community connect with our local candidates and our local lawmakers so that they can see that there's a way they can help, even if they don't want to run, how can they help other local people to run and win, and how can they find out more about the state's issues. But I do think it will be challenging to think about how we're going to find new ways to connect on the things that are important to us this year.
Yeah, it's extraordinary times in many, many ways, right? I mean, certainly some of the issues that have to do with equity and justice are front and center. But as you say, how are you going to connect? In a lot of ways, I think you got some really great opportunity because of the social media, because of these Zooms,
right,
because of these calls. We're trying to put a map of Rhode Island on our transition team that brings geographically every community, and then in some shape or form the communities that make up our communities in a true sense. We're going to have a call of, I think, almost 200 people right now that are going to be on that call that want to help have a voice in the transition and all the different variations that represents, right? But we would never have been able to. We're going to have a call next week, and then people watching and listening that want to, would like to have some input in terms of what the Rhode Island is going to look like, through the governor's office, invited to participate. But you could never put that many people together in a short period of time and then actually be able to communicate with them. So there's some upsides here. There's some challenges though, Wendy, as well. You must be seeing that, both you and Hillary, on the university level as well. But what's your thinking? How do you think you kind of work your way through the distancing right now and the infection rates? We've got the vaccines. I want to have you weigh in on the vaccination issue in terms of spell. But how do you deal with this this current moment in time and still be able to organize and communicate and keep your RI now moving in a real positive direction as you have over the last several years?
Well, I'll jump in. So one of the, as you said, one of the positives from this experience is that so many things are virtual now. So just as examples, because we're an all volunteer organization and because it's just how we work, pretty much all of our legislative advocacy is done in coalition with other groups and coalitions that exist. So for example, this year we're part of 6 coalitions, which I can go into in a moment if you'd like. But in the past, sometimes it's been hard to get people, our volunteers, to represent Rhode Island Now at those meetings because they're at 9:30 in the morning or 3 o'clock in the afternoon in Providence, but the person who wants to go is working in Westerly or something. So it's actually been amazing that more people can engage now with this legislative advocacy, specifically in the coalitions, because they can either call in or be in front of their computer. And I do think and hope that that is something that's going to last. And if you can't go in person, there's just always going to be an option to engage in either via the phone or via your phone screen or a computer. So I think that's really great. I think where we really run into problems, as you mentioned, is what if the General Assembly is not meeting in person? What if they're having some sort of abbreviated session? We have always done written testimony for bills that we care about, and we already did some of that last week and plan to continue doing that. I know people are able to testify by phone at the moment. It would be great if we could be seen live in the way we are right now, because it's very hard for people to stay engaged when they're just staring at a screen, but nothing is happening on it. Like, it's not interactive at all. So that is definitely something to overcome. So again, we're going to embrace the positives and hope that that continues to move forward, and just find ways to continue to engage, whether that's writing more letters, making more phone calls, doing emails, or doing postcards. There are always ways to engage. And someday, I'm sure we're going to have some big event in the future or rally, and it's going to be so amazing because we haven't been together in so long.
Yeah, Lilia, how do you move forward? Some of the things that even in your your career, or even in the context of this conversation, under the current environment and those conditions that are restrictive in a lot of ways.
Yeah, I mean, I think the environment that we've all been living the past almost year has definitely been an interesting one to navigate, both on a young professional front, but also, working with these nonprofit organizations such as Now. I mean, so the nonprofit board, so Hillary and my events co-chair, we've recently tried to start brainstorming some ideas to enhance and broaden our virtual events platform a little bit, because before, as the photos that you had up shown, we were a very in-person engagement type of organization before, which was incredible. It was great for community building. It was great for meeting people and, meeting other women and other people in your community that, were there for a specific purpose. And so now we're really trying to think of virtual ways to kind of have that same community building experience. And I think it's going to work out great. And we have some really good ideas for 2021 going forward that we'll be posting on our Facebook. That's usually how we engage with our members, and either our website or our Facebook and Instagram have our events posted on them. So it's a work in progress. I think that everyone is trying to kind of navigate this road one day at a time and kind of figure out the best ways to approach things and how to best have people engage and feel like they're a valued member, not just a person sitting behind a computer screen.
Yeah.
But I think that we've done a really good job considering all of these challenges. And I think the combination of having these virtual platforms, along with, hopefully, knock on wood, in-person socialization again, will be really great for our organization. But I think in general for everyone in their personal and professional lives.
Yeah. So you mentioned that you're in finance. Are you virtually doing your work, or are you are you doing that from your home? Right now?
I've been working from home since March. My office is actually in Boston, so I have not been in my office in months.
Yeah.
But we've definitely adapted. It's been really incredible, the work that my team and kind of the leadership team of the organization that I work for have been able to implement in a really short amount of time. To be honest, the turnaround time was pretty incredible, but we've been able to manage through these virtual environments with our clients and with each other. Of course, there's always challenges, but it's definitely been a learning experience, but it's been a good one so far.
Yeah, our daughter was working in Framingham in finance and living in Boston, and now she kind of rooted up because she's not going to go back at the earliest now until the end of June, early July, and that's been
Same.
So she took up a place in Newport, and and then she's working virtually and doing the same work, just in a different different delivery, right? Delivery of that work. But I think that your flexibility in that. I find that the young people that I'm working with, they seem to be very flexible in these formats. So that experience is going to bring a lot of value into the work that Hillary is driving along with Wendy and yourself. So I wanted to talk about the COVID a little bit. The virus, how that's impact. Not we talked a little bit about what it has impacted with in terms of getting out to meet with people and lobbying and doing that, but just personally. And inside what do you think that has meant to the members of your organization, Hillary, in terms of what challenges are different today, and what have we maybe have learned from those challenges, say for your membership, because you got several hundred people that are members of the RI now, right? So they are, and the majority are women, right? You allow men to kind of come along for the ride, but the majority are women. So give us a little reflection on not only yourself personally, what the COVID has meant, but also to your membership, in a personal sense, not necessarily in the advocacy area.
Well, for sure, people have been touched by loss and death specifically. I personally am thankful that has not happened. And my mom in particular is very high risk medically. So I've been grateful for that. Of course, I have not seen either of my parents, one in over a year and one in almost a year. One of my parents lives in Arizona and the other is in Florida and in Michigan part of the year, snowbird. So, I guess that matters the most actually for my kids and for my parents who have not been able to see their kids who are growing up. So that's pretty big. Obviously for my students too, this has just been totally, change their lives in every way. And many of them who are also Rhode Island Now members, in the scheme of things, again, no one's really sick and no one has died, but they lost their ability to graduate from college with their friends and finish those experiences. And I think that's going to impact this entire generation. I mean, for someone like me too, and many of our members who have young kids, the impact, we're not going to know the financial impact for women in particular for a while, but the implications about childcare and then also housing instability, they're just enormous. I'll let Wendy talk more about the medical and psychological things, but I think that's one thing that's really, really been driven home for me, having young kids who are more capable, they don't need as much of my attention, but they need a lot. And I told someone when they said, what's the biggest thing you learned? And I said, this whole thing about it takes a village to raise a child. I don't know. I feel really upset. That was a lie, because at the end of it, it was just us. And that is something that I think I and many others in our Rhode Island Now membership will have to grapple with longer term.
Yeah. What about in terms of your membership too? We know that there's highly impacted individuals, communities, and have you found that the members of the organization have been challenged in a way that say I wouldn't be, in terms of the work that they do and the dependence that the families have on women in particular?
Look, what we've learned from COVID-19 is that other countries have social safety nets and America has women. I joked, but it was true. I hadn't remembered since my kids were really little that kids need to be fed 3 times, every single day. I would joke about it, but I was like, do you know I have to feed them 3 times every day? And there's so many more dishes and there's more laundry of a different type. And, it is, can be overwhelming, even for someone like myself who is so lucky not to have to worry about housing and where is my food coming from. And I think for anyone who has to worry about those things additionally, it's just so painful. And also for many people, as I mentioned, the loss of community is really traumatic. And those are major things. But this realization that I mean, if you look at the jobs numbers, right? Like it's women who are leaving their jobs, women who are becoming unemployed, and that's just unacceptable.
Yeah, and the other thing I was going to say is just in terms of, who we're seeing as who's taking care of the sick patients, who are taking care of people in nursing homes. They tend to be fields that predominantly have women in them. And we're seeing women having to cut back their hours and either losing their jobs or feeling like they need to give up their jobs. So also, just looking at things like wages, what are people in these industries paid, and things like housing. It really kind of brings it home when something like this happens. You start to see even more how some communities are hit by it.
Yeah, and Lily, so you're online with a number of the members, I would imagine, that of RNI. What are they telling you in terms of their personal experiences that, the shift in terms of the impact that the COVID-19 has had on them as well? Could you, if you can recall, I think, share maybe a little bit about what they're telling you.
Yeah, I mean, one word that kind of jumps out at me is isolation. And I think for everyone, whether you live with a family with children or you're a married couple or you're not, a lot of people live by themselves, are young professional women who live alone. And I think that this experience of COVID-19 has really pushed the boundaries of everyone's ability to kind of feel themselves in isolation, but also not have that same connection. You're just not able to do the same things that you're able to do in normal times. You're not able to go grab a coffee with somebody. You can't go out to dinner with a friend. You can't see your parents. I mean, even for me, it's been really hard because I have a family of teachers and they're in the classrooms doing their job. They're going to school, they're seeing students, and that impacts how they're able to interact with their close friends and family. So I think it's really an interesting dynamic, but you see a lot of people really grappling with feelings of isolation, but also legitimately being isolated in their homes right now.
Yeah, that certainly rings home. I think that's a separation strategy, especially if you happen to have a family and a network. Louie's making meals there 3 times a day, but that's still that there's a certain amount of interaction there that, whether we embrace our kids and we love them, and that experience is so important to us. But what do you do is, my mom lives with us, 92 years old, with Sue and I right now. Our kids are, out of the house, so for 10, 15 years out of college now. And, but they've been isolated as well. And, Kara Newport, she does finance. She loves to sing, and she's, out with groups like that. And, but that's not there any longer. She's sitting in, in a nice condo in Newport, which I don't feel bad for her because it's kind of nice down there. But at the same point in time, we do realize that, we're spending a little more time traveling down to Newport and saying hello and trying to do that. So, interacting, I think that, at least my experience, I don't know if you want to weigh in on that, but my experience is this is the time when, if you have somebody in your life, a family in your life, and they are isolated, regardless of how old they are, and that effort to extend yourself so that they're not as isolated seems to make a lot of sense.
Absolutely.
Yeah. So I wanted to talk a little bit about, some of the things, the challenges that I think the state has, and anything that challenges the state certainly challenges, members of your organization. But the vaccination issue is going to be a front and center issue. And we've got a limited supply with a high demand. And so, we're trying to project ourselves when we're going to have supply, and then how are you going to distribute it? So, it's an important issue, and just your personal perspective on the the vaccinations and the vaccine Hillary, and whether it's in context with your own personal life or in context of the work that you do in RNI, or just generally, the impact that that's going to have if it's done well, and if it's not done well, we're going to continue to be isolated and struggling, and business is not going to open up, and on and on and on. So, do you have a perspective on that at all, or even personal, or even professional?
Well, I mean, I'm way at the back of the line, as I should be, because I'm a fairly young person who's healthy, and grateful for that, and not a frontline worker. So I'm very, very glad that our frontline workers in the medical profession on many levels, many of them have been able to access the vaccine. I think we need other people who were designated essential and frontline workers to be able to access the vaccine. And then I have to say that teachers really need to be able to access the vaccine, especially those who are teaching in person. And that especially includes like special education teachers who are working with kids who really need to be in person in order to learn in the way that's best for them. So I do believe that teachers need to be much higher up. And I mean, I will say also, like, I'm very glad Central Falls has been vaccinated, because that's a community that's been hit so hard, and perhaps thinking regionally and saying, we're going to vaccinate an entire community as opposed to just the people who are over 65 or over 75 in a community, that once the like most important frontline and essential workers get the vaccine, perhaps going in that way. And, even like in Providence, not all of Providence might be vaccinated at the same time. Certainly certain communities within Providence were hit harder. So like the East Side would not be at the top of that list, but eventually it will get there. But Pawtucket, Woonsocket, like those were all communities that were super hard hit, and we need to prioritize those areas especially. But yes, teachers need to get vaccinated because for so many reasons. But I mentioned childcare, but it's like if the kids aren't in school, it's just such a ripple effect. How can the economy reopen? And the kids are having learning loss, and it just compounds itself.
Yeah, we're working on my national network happens to be in education, and so that's coming alive, and I think that's going to, have a benefit. And we're working with a core group that is, really focused on the value of, having the teachers and the staff in the schools, become vaccinated for many good reasons, and I happen to feel as though that is an urgency. So as you heard me kind of open up the show, this loss of learning is real, and that loss of learning is going to stick with the boys and girls for their lifetime, unless you strategically figure out how to, pick up on those lost learning hours, and also we're in a race to make sure that there's not another 500 hours of lost learning, right? So the sooner we get back there. Wendy, what is it, certainly in your profession, and also, on the vaccination, what's your thoughts on that?
Yeah, so I work in healthcare, and I was fortunate enough to be able to access the vaccine. I was really happy about that because I've been working in the hospital throughout, since March. So that was great. But I'm a psychologist, so I know that, people's beliefs about vaccines is really important. And I think because I work in healthcare, I work with so many people who are so grateful for the vaccine and really have wanted access to it. But I know that it depends on where you live. It depends on what your experience has been with research in the past in terms of some of the inequities and how people have been treated. So I think it's going to be really important in our state and, across the country for there to be really, ways for people to get solid information about the science so that they can feel that they can trust this. It is a problem of access, but we want people who, especially the people who are most vulnerable, to feel that it's safe and to be comfortable with accepting it.
Yeah, what about like the pressure that's on because the supply is not meeting the demand? How do you juggle that? How do you talk to people like in Warren right now? Warren has a high infection rate, one of the largest in the state. We had a community meeting that we've been starting on these Zoom calls, right, with civic and local leaders, school leaders, just to kind of reinforce that they are playing a role in controlling the infection rates and containing that and helping us move ahead. But they'll say, hey, it's great that Seminole Falls is getting it, but how do you answer them? We've got a high infection rate. Our health is at the same level of risk as a community with the same infection rate. How do you manage that?
Yeah, I think it's hard. I think transparency is so important, transparency and communication. So I know that our Department of Health has put out, some nice visuals about what the priorities are. This is when the meetings are. This is what our thinking is right now in terms of how many vaccines we're getting per week. This is how the things that we're taking into account when we decide on these priority groups. I think that can, people are impatient, but it helps them to know that, oh, you are thinking about my group, or, oh, you've got some clear criteria. It's not like because you know a guy that you're going to get a vaccine. So I think the transparency and communication can help with people's anxiety and their impatience.
Yeah, it's a tough call, isn't it? I mean,
It is.
And until that supply starts meeting the demand, and then we've got a challenge to make sure as the supply steps up that we actually get as many shots in the arms, as many people as we can, as quickly as we can. So
Right.
no one's saying on who's distributing it to us, oh well, you're not getting it out fast enough, so you'll wait for your next round until you get that one out. So I like what you're talking about, that transparency issue. I think that there needs to be, like an eligibility portal that people could actually go to and say, okay, this is based on today's, supply, this is where you are. And then if the supply doubles or whatever, this is where you are. So that information, I think, Wendy, that's really good advice. So Lily, and same thing on the vaccination. It certainly impacts people in your lives, but what are the people in your network saying about that? Are they taking it? Are they waiting in line, or they know that they got to wait, or are they actually saying, we're young enough, we don't need that type of stuff,
I mean, in my network, and with my close friends, I have a group of people that were lucky enough to access the vaccine because they work in, they're frontline workers, and they were very excited and really thankful and grateful to be part of the distribution of the supply that we have. The other thing for us that are kind of at the end of the line, it's just maintaining that thought of, your defense is the best offense right now, and just maintain the mask wearing going forward. And I'm really happy that we'll have consistent messaging and communication on a federal level. We've had it on a statewide level so far, but just having consistent messaging for people to rely on, I think, is really important. And then, I think we're all kind of ready to run out the door as fast as possible when it's safe. But I think, at least for me, the majority of people that I've spoken with about it and engaged with are ready to go when it's available. But at the same time, we're patiently waiting with our masks on.
Yeah, I like that. I always bring my mask out there. I got the, let's stay positive but test negative, and we're out there. Certainly that's going to be messaging in 2021. We're running up against the clock a little bit, but give us a little bit of an idea of how, if somebody was watching this or they were interested in getting involved in RI Now, Hillary, share that with us, and then we'll get closing comments from Wendy and Lilia.
Well, we have a website, rinow.org, where you can find ways to connect with people on this call. Social media is a great way. Facebook, we share lots of events. We have an event coming up Monday night. It's our January Legislative Committee meeting that's open to everyone. You do not have to be a member. We love to have members and dues-paying members, which helps support our legislative advocacy, but we're open to all, and that's on Zoom. from 7 to 8 p.m. So you can look for more details there. And we are also on Twitter and Instagram. So you can look for us in all of those places. Once you sign up to be a member, you get one of our quarterly e-newsletters. And that's a great way to stay engaged as well. So we'll be doing quarterly events, as Lilia mentioned. They'll be virtual for now, and then I'm sure we're going to do like a big bash once we've gotten our vaccines.
Everybody's getting ready for a big bash. There's no doubt about that. Wendy, tell us why somebody would want to kind of follow up. I see Lilia's tat there.
Yeah.
And
I knew I was going to make it
Wendy,
appear.
why would they want to follow up if Hillary just pointed out?
Yeah, I think, I going back to the inauguration today, we know that really being engaged in the electoral process, knowing what the issues are, really makes a difference. And to me, it's our duty, our civic duty, and being involved in an organization like Rhode Island Now is also really fun. And you get to meet a lot of people.
Yeah, that's good. Fun is always good. We can bring a little fun into it. Lily, last comment from you, and then we'll kind of sign off.
Yeah, Hillary covered a lot of how to engage. We're going to have quarterly virtual events coming up, and our social media is usually the best place to kind of find out or what's going on, but always feel free to shoot us a message on social media, and we're very responsive. Again, we're all volunteers, so we really try our best to make sure that we're keeping up to date with everything and everyone. But Rhode Island Now has been an incredible opportunity for me to meet people. But like what Wendy said, it really gives you a sense of pride to engage with our elected officials. I just think you build trust in the people kind of running the show and making a lot of the decisions. And Rhode Island Now is a great platform to be able to engage with those people.
Well,
thank you. So thank you for having us.
Yes.
Yeah,
Thank you so much.
If you want to learn a little bit more about Right Now, you can call our office too and ask for Cheyenne, and she'll definitely tell you how to get in touch. So if you're listening, 222-2371, Ben can put that up, and then that would be great. And then we'll share it. Anybody calling us, we'll pass along their names to you, and so that you keep the good work going. Thank you so much, and sharing that historic moment today. I'm glad we were able to talk about that. That was like I was saying, that was a hallelujah. Thanks. See ya.
Thank you.
Yeah.
Thank you.
Yeah.
Happy Inauguration Day, everyone.
Yes. Yeah, so that's a great group of women, and just like any other organization in the state of Rhode Island, volunteer, get involved. It doesn't matter whether it's a veterans organization or a women's organization like that, or someone that is working on Boys and Girls Club matters. As I was very involved in Boys and Girls Club work, and when I was president of our boys club, we changed the name of the Boys and Girls Club. So, volunteer. That is I think that's one of the biggest lessons right now of the COVID is that, as you reflect on, the time you're spending, whether it's isolation or not, find a way to volunteer in our state. We want to stay positive, test negative in 2021, but if we're volunteering and engaging in a worthwhile project, the state of Rhode Island gets better, and that's our goal. So we'll be back on Tuesday for the small business town hall at noontime, and we'll be back here next week at 7:00 on our community conversation, and we'll keep you up to date on what's happening in Rhode Island and what's important in our state of Rhode Island. So thanks for being with us. Stay safe.